So next debate will be about what causes MS. This is not a $1 million question, it is a tens of $billion question. So it would be much easier if we would know the cause of multiple sclerosis. But we know that genetics and environments affect the development of multiple sclerosis. Environmental factors, we know that prevalence, northern to south gradient, then migration studies, risk of developing MS depends on when you move to the low or highly risk area. For example, this is a study from 25 years ago showing that immigrants from India, Africa or Caribbean to the UK, I mean the children of immigrants have the same risk as native population. There was a long search for infectious agents of multiple sclerosis. Perhaps the best evidence now is for Epstein-Barr virus. This is a population-based study from US showing that if a patient has high levels of anti-EBNA EBV, then his or her risk for developing MS is much, much higher. Then prevalence in Nordic countries, it has to be something with sun exposure, vitamin D. This is a meta-analysis from a couple of years ago showing that MS patients have lower levels of vitamin D in the blood. And smoking. Interesting that only smoking is increased factor for multiple sclerosis, but not consumption of nicotine in other ways, like chewing tobacco, suggesting that perhaps some lung irritation is important, perhaps even activation of antigens, CNS antigens in airways, that's important in developing multiple sclerosis. And of course, genetics. If we simply look for a baseline prevalence of multiple sclerosis, which is 0.1, 0.2%, and then prevalence of MS among relatives, which increases to 5% in first-degree relatives, 30% in identical twins, that it's obvious that genetics is also very important. There are over 200 risk alleles associated with MS susceptibility. HLE, DR15, so these antigens are mainly important in immune response. Some HLA alleles are increase the risk, like DR15, and some, like A2, decrease the risk of multiple sclerosis. And more recently, there are studies showing that there is also a risk between like two environmental factors like obesity or EBV or genes and environment. This is a study from Stockholm showing that if one has two genetic risk factors and smokes in addition, then his or her risk of developing MS is much higher than it would be by simply adding the three risks together. So that's why we have this discussion about which of one is more important. For genetics, first we'll have Dr. Chowdhury from UK, and then for environment, Dr. Miller for Israel. So we already did the voting. Dr. Chowdhury, please.